I was lucky to follow Sandy Boo, my friend. First time I met Sandy, after an hour, I felt like I'd known her my whole life, and she's one of my friends now. We don't see each other often, and it's the first time I've had a chance to share a podium with her, and it's great to be here. It's great to be here, and what a great set of comments here. This audience is really, you guys are smart. You're really way ahead of the game. Are we ready to go here with the slideshow? I don't know. Is the projector on? Is the projector on? Can you? No?
Let's see.
It's trying. Jim spared you my CV, but what I do want to tell you about me is I was trained in internal medicine at Hello? No?
That might be for the tape. You need to do that one.
I got two mics, no projector. There we go. I trained in internal medicine, and it was really tertiary care. Basically, almost like an intensive care unit for 3 years. Is basically what it was. I mean, that's not what they said it was, and I became very discouraged. It was really sad because it seemed like everybody was dying, and everything that we tried to do either made them sicker, or you were just sort of choosing what avenue with your therapy, whether they're going to go out with you this therapy or that therapy, and that's why I ended up where I am today, because I wanted to go out and prevent. And so this conference to me is exciting because it's about prevention. You know, dealing with a traumatized population, dealing with childhood development is, I am convinced, the one and only best avenue for having a healthier society. So that's what I'm going to talk about today. That's my main point for the day. And I like to use art when I present. When I first, my way of dealing with vicarious trauma was to go to my art books. And I found out later that people use art therapy for that, and I just sort of did it instinctively. This was up earlier in the day, and I've never used this piece of art before, so I'm a little anxious about it because everything for me now is a Rorschach blot for trauma. And if you just take a minute to look at it, and if we have time, maybe we can come back, and I'll tell you what I see in this. I see Sandy Bloom's presentation in this. I see a lot of things we talked about in this piece of art. And if we have time, we'll come back to it later. There's an extraordinary convergence of disciplines coming around trauma now, and it's really exciting because economists are now coming together with neuroscientists and child development people and saying where in our society, if we want to put resources of our society into something from an economic viewpoint analysis, that this is where you end up. In the brain, as in the economy, getting it right the first time is ultimately more effective and less costly than trying to fix it later. And this is a Nobel Prize winning economist from the University of Chicago who's now writing papers on developing children and the economics of that you get your bang for the buck by taking care of the kids and having healthy brains. And now I'm going to tell you a fish story. That's me. And it's not a fish story in this. I really did catch that fish because it's on the photograph. But the part of the fish story here is it's about my son. And I've been traveling, so I bring my family with me. I miss him when I'm away. That's my son, Will. He's about 5 years old there. And I fish at night when I fish. And he's now 15. And I fish out of a canoe. And I'm not really a good fisherman, but this little lake by our house is so full of great fish that, you don't have to know how to fish. And I hauled in this largemouth bass. It was unbelievable. I thought it was a turtle. Because the head was so big, I thought it was a shell of a turtle. And when I pulled it in, I could get my arm down inside. The mouth was like that big. I could get part of my arm down in the mouth. And so I called my wife on my cell phone because I didn't have a camera. And I didn't have a scale or anything. I thought, this is like people live their lives trying to catch a bass like this. And my son, she woke up my son and brought him out, brought Will out. And I said, well, I'm going to use this bass. Put it out in front of my son and use Will as the scale so you could get an idea of how big the fish was. And I could go golfing with my friends and brag about this fish. And then I got this really brilliant adult idea. Here's where the stress thing comes. I thought, well, that thing is really big. I said, well, Will, turn your head sideways, and I'll turn the fish sideways, and we'll put your head inside of the fish's mouth. And he was terrified. He was terrified. A few years, and right about this time, he was also telling us that at nighttime there was noises in his bedroom. God, these kids, they make things up. And I came home from work early one day, shortly after that, and there was a little hole next to his bed in the wall. And I looked in the wall, and there was eyes looking back at me. And it was flying squirrels next to his bed. They're about to crawl down into his bed. And so my point is that I'm not educated to be a parent. And I did things that scared my kids, and I didn't listen to them. And recently, my son told my wife that his career aspiration is to be a child psychiatrist. And that's true. Oh man, now he's thinking he's going to try to work all this out and all these things that I did. Anyway, I've learned so much from doing this work about what I didn't know about children that I was never taught. I didn't know about trauma. I didn't know about brain development. And I've had to learn by getting involved in this research and going to meetings like this so that I can talk about it. And I've got all these degrees and all this BS I've done in my life. And I didn't know the most fundamental things that I needed to know about my own kids and society so that I could go about my mission of prevention. And I'm lucky to have found that in this kind of work. This is a piece of art called The Walk to Paradise Garden, and it's by Eugene Smith. I could talk about this piece for a while, but I'm not going to do that. I see two children, the beauty of childhood. I have a son and a daughter. I see them. I see myself. But really, what I see sort of all kids, and they have a bright future. And somebody build a beautiful garden. They can go out and play safely in the garden, and it's really a hopeful picture. It's wonderful. Now that I know what I know about the reality of the average childhood in our society, I know that I'm projecting onto this photograph what I wish for in the lives of these children. And that's one of the things that I think we have to overcome as a group in our communities and in society, is to get people to look at the reality of how stressful and traumatic childhoods are in our violent, stressful culture. In order to understand the findings from the ACE study, I had to go back and learn about brain development. And here are some of the key points from Dr. Bruce Parry. Number one, the brain develops from the most primitive functions to the most complex. From the lower part, from the brainstem down low, to the middle, to the higher parts of the brain, from the bottom to the top, sequentially over time from birth. The normal development of systems and functions they mediate require specific signals at specific times, those signals being your experiences from the people and the environment around you. And there are critical periods that are times of sensitivity to environmental input, especially stress, the poisonous biology of stress. It's human biology, we know that now. And different functions such as regulating anxiety and mood and abstract thought that occur in different parts of the brain develop and mature at different times in the life of a child. Here we have this idea of sequential brain development. This is birth here, and this is in the womb. So we're starting 3 months before birth. And different brain functions have critical periods or where there's a peak capacity for the nerve cells to wire up and acquire different types of functions. Here we have in yellow the sensory pathways, seeing and hearing. Next comes language, peak about 5 years old. And then the higher cognitive function, things like reading and math and science, and the things that we tend to think of as being the more kind of human functions. And I think that's a mistake that we make. A mistake that we make with kids is that their job is to learn higher cognitive function, and it is not. Their job is to explore and learn and find safe things to do, and they know what they need. They're born with what they will explore and find the things they need, and we need to get out of their way and make it safe for them to do that. And I didn't know that until this year, when I heard a child development person talking about what kids are really about, and my concepts were wrong. They know what they need, they will seek it out, and our job is to make it safe, not to prepare them for the SAT test. Right? This piece is called The Limits of Understanding by Paul Klee. And I like to show this because here at the bottom, I see a head. You see the human head with the eyes and the ears. And the lines and geometry. I see that as the part of humanity, the slice of humanity and human development that is that higher cognitive functioning, because it's math and geometry and science, and we're aware of those functions and we can manipulate them as we please. Connecting those functions is a ladder and a scaffolding and plateau, and then there's this middle dark area. And Sandy alluded to this morning. This is probably more about what we are as mammal Homo sapiens. It's the unconscious part of ourselves. It's our emotions, our satiety, our sexuality, our appetites, things that we don't have a lot of conscious control over. So that's the middle part of the brain. The middle part of the brain that we'll talk about later. And at the top is a dark circle. And I see that as the dark circle of wholeness. Abraham Maslow, in his hierarchy of needs. Anybody? I had to learn that recently too myself. I didn't have a psychology course ever. At the top of the hierarchy of needs in humanity is spiritual fulfillment. But the idea is that you have to have sequentially your needs met over time. You have to be safe. You have to survive. You need to be nurtured and loved, and have all these things develop so that you can achieve wholeness. And so that's my journey. It's your journey. It's everyone's journey. And I think what we're talking about here is how are we going to create a society where this occurs well most of the time, rather than having to go back and try to repair it. And it's very difficult to do. This artist, I think, is a genius. And I couldn't find the artist's name. But what this is, this talks about, this embodies many of the things that Sandy talked about this morning. What's going on here? Repetition, compulsion. See, the adults, what are they doing? Why do you think they behave like that at the dinner table with a small child? Why is the dad dangerous and brooding with a knife, looks like he might stab somebody? Why is mom screaming? Where'd they come from? And what's happening to that little boy? He's terrified. He's in fight or flight. And we know you can't see that, but it is poisonous to him. Just like lead would be poisonous to him if we fed him chips of lead paint. It's bad for his brain because the fight or flight response involves adrenaline, which is a neurotransmitter. Nerves talk to each other through chemical pathways. Adrenaline is one of those chemicals, and his brain is trying to figure out how to do things. It's being flooded, overwhelmed with a neurotransmitter, and the steroid called cortisol is released as part of that. Cortisol inhibits the ability of nerve cells to reach out and make connections, and in really high doses in animal experiments, it kills nerve cells. So this is the intergenerational transmission of the poisonous effect of toxic stress on brain development. Are you with me on that? That's what we're talking about. This is human biology. Once you've seen it a few times and talked about it, you can transmit this. Everybody should have some basic knowledge of this. Every person, not just service providers. Everybody, every parent should know. Children can learn this so that they know that when you stress another person, you poison them. Person-to-person transmission of these experiences create people who then regenerate those experiences for their kids like these two parents are doing. And I don't see this as anybody's fault. It's the way it is. It's not anybody's fault that there's influenza in the environment and it's person-to-person transmitted. Our job is to understand how that happens in the biology and to reduce the transmission sequentially over the next few years, maybe. So we're talking about stress. And this is the biochemistry, the physiology of stress that I'm talking about. The stress response and the release of the fight or flight chemicals that go to your brain, and if it's unpredictable or severe, it leads to vulnerability. That vulnerability is the altered functioning of different brain systems. It's the altered functioning of different brain systems. And if there's many episodes or it's chronic, it's worse. If it's predictable or moderate, it leads to resilience. You need to be, as Sandy mentioned this morning, you need to be challenged in order to be able to be functional. But if it's overwhelming, if it gets to be too much, then it inhibits the ability of the nerve cells to connect and create the functions that will make you a whole human being. There are genetic influences. The area that I think, if you see this, try to read it. It's difficult reading now, but epigenetics. If you haven't heard that term, it's the first time. What epigenetics tells us is if, say my BlackBerry is a gene in your DNA code in your cell. Genes code for specific functions of cells. We have several 100,000, 300,000 genes. Epigenetics tells us that experience can cause chemicals to attach to a gene so that can't be read, or it can cause the chemical to be released from that gene so the gene can be expressed. And so what this tells us is that the behaviors, including parenting behavior and some of the behaviors and diseases that I'm going to show you about, are probably, I believe, modulated by the effect of experience on the way our DNA code is read, when it's read. This is not mutations. This is the fluctuations in how our genes are expressed. Very important. And of course, the exposures in the womb. The exposure to stress and chemicals in the womb is extremely important. This is a public health Rorschach for me, and I'm going to tell you about why I see it that way. First of all, because I never took an art class, I used to see those two fingers touching and say, well, that's game over. Thank you, Michelangelo, the creation of Adam. And then I had this moment where I saw more in this. I saw the divine reaching out to man. And the divine has its other arm around who or what? The left arm. Anybody ever have art appreciation? I don't know what Michelangelo meant. The divine has his arm around woman. And underneath the divine is this little creature, and I believe that's Cupid. When Cupid helps the divine bring man and woman together and pass the divine spark, what happens? That's where babies come from, folks? Babies? Okay. So I see this as the divine moment of conception. Okay, so there's a baby there. This is the moment of conception. Right there. And then I see the shroud in the back. And I looked at that again, and I said, well, that's an ovary. Because you see the little faces here? Faces of all ethnic groups in here, by the way. If you look at it closely enough, those are eggs. Or they're spirits waiting in the heavens to be embodied. Now, here's the public health part for me. And this is a perspective that I would like you to take in discussions, is when I see this, I see the 4 million births that are going to occur in the United States this year. And imagine, if you will, imagine a national nursery with 4 million babies in it. It's kind of hard to imagine, isn't it? 4 million babies. And I don't know how many, there's hundreds of thousands of births in New York State every year. And say, what do we want for those babies coming this year? And get out of the box. I know there's a lot of barriers, but blue sky it. Say, what do we want for those babies? What can we do to get it for those babies? And forget your budgets. And I know it's hard. Get out of your categories and say, if we are going to create policies and programs to prevent the kind of things that I'm going to show you about, think about those waves of babies coming on a population perspective. That's public health. This is the moment of conception under a microscope. Sperm penetrating an egg. And if you're willing, travel back a couple of minutes and go to that dinner table with that little boy and that stress family, toxic stress family. If this is happening in that mama's womb, and there's a house next door that's relatively peaceful and adapted, what's going to be the difference in the biology of the moment of conception in the stressed out house versus the calm house? Stress. The poison of stress is already going to be in the sperm and the egg. And when that becomes one cell, I think that it can influence the trajectory of that cell that's going to become one of those babies. A few weeks later, there is this creature. And I used my children as experimental subjects a few years ago when they were, my daughter Kelsey was about 6, I think Will was 4. I showed them this separately, a double-blind trial in my kitchen at home. I did not have human subjects' approval. But they both said the same thing when they saw this. It was really kind of, they both said, Daddy, that's a dinosaur. Yeah, it's funny, isn't it? But kids are smart. It is like a dinosaur. And that's what we forget. And we saw the films of all the functioning of the fearless. Things get turned on, these evolutionary things that we have. And I see in an embryo, this is a human embryo, we undergo the process of evolution in the womb that we can't see. We have a tail. These will be legs, but they function as flippers. If you see ultrasounds, these little embryos swim in the womb on the stalk, on the umbilical stalk. We have, this is going to be lungs, but at this point in time, they're gills. Functioning, embryologists call them gill slits. And here we have the central nervous system, the hindbrain, the midbrain, and the forebrain, the cortex, the middle of the brain, the unconscious brain, and the less conscious brain that operates our heart and lungs and digestive tract. Those kind of automatic functions. And eventually you end up with a mature brain. And it's really quite a journey. And the important part is all of these various anatomic things that are identified here. This is the hindbrain. This is the middle of the brain, the emotional brain, the part of the brain that I talked about earlier, the unconscious thing in that piece of art by Paul Klee, that dark area. And then there's, of course, the cortex. And any of these functions that this brain acquires during infancy and childhood can be affected by toxic stress. And so, therefore, the manifestations of toxic stress are potentially unlimited because of all the different brain functions and the fact that the brain is interactive and rhythmic, and one function requires the other to work well, is why there are so many manifestations in health and social sciences of toxic stress. If you go back to that embryo, a few weeks later, there's this little creature, this little baby. And if you biopsied that baby's brain, and that was not done, this child was unharmed, born alive, and if you look at under a microscope the brain cells, what you see is the bodies of the cells, and these are the axons, the connecting tubes of communication. The point here is when you look at this, the axons, the tubes, the connecting tubes for the messages are not touching each other. We're not touching others. So a characteristic of us as Homo sapiens is because our brains get so big, we have to be born with our brains as potential brains. Because we have to fit out of Mama, that space in Mama's pelvis about that big, or just barely that big around. It's kind of hard, isn't it? Seriously, giving birth. As a medical student, first-year medical student, I fainted. I was taken to see a birth to say, well, I fainted. It's tough. So if our brains were any bigger, really. That's a really important thing to remember about our species. We're born with potential brains, and it wires up largely after birth. And that is why our kids are so vulnerable to the negative things that happen. It's why there's so much potential. If we provide a rich environment, there's so much human potential, but we're wasting it. We're wasting that potential. We're ruining it in our society. Here's a set of scans, brain scans at 5 days, 2 months, 1 year, and 28 years. And what we're doing is you're looking down on top of the head with the left ear, right ear, and the nose on the top and the back of the head at the bottom. At birth, this area is really active. That's the hindbrain. That's the brainstem. What do babies have to do? They're born with what they need, so what do babies need to be able to do? We all know that, right? They need to find a nipple and suck. They have to breathe. They have to have a heartbeat and blood pressure and digestion and elimination. So that's active. And they can see, this is the visual part of the brain. They've got blurry vision. But not a heck of a lot else. Although we project a lot onto those babies of what we think they are, that's all wrong. Don't we? Oh, gee, look at this picture, right? Come on. 2 months. At 2 months, they're seeing much better. The brainstem's always going. And this dark area where there's a lot of activity is the associational part of the brain, the social part of the brain, where you learn to recognize a face and how to respond to other people and who Mama is and reflexively respond. This comes online, so to speak. It comes online biologically at that critical period in time. And so this is attachment, critical part of attachment at 2 months. And I believe when Sandy talks about attachment having primacy in trauma-related disorders, I believe it's because that is one of the first functions that comes on that we can recognize, and everything else is dependent upon that function. You with me on that? It's probably why attachment disorder is a prime part of developmental trauma disorders. At 1 year, the brain looks more like a 28-year-old brain than a 2-month brain. And that's the point of those two frames. That's what the early child development community is telling us about the early times and how important they are for building a foundation for a healthy life. Here is a set, 3 sets. This is nerve cells, brain cells. A few of them, maybe 6, 7, 8 at birth. They're not wired up. At 6 years, same number of nerve cells, thousands of connections. Thousands of connections, so there's the nerve cells are programmed to reach out and connect, and the connecting of those cells is dependent upon experience. It's been called Darwinian by neuroscientists. It's a survival of the fittest. What connections are fit to come together and survive and stay there is dependent upon the amount of experience that comes into that part of the brain, and for better or for worse, whether it's the kind you want or the kind that you wouldn't want, it wires them up. Then at age 14, there's a process called pruning, where somewhere around half of the potential connections shrink away. Pruning. Branching and pruning, experience dependent, such that you end up with scans, 2 different children, one on the left, and you see the circled areas. That associational attachment part of the brain, recognizing other people's faces and responding appropriately. The red is high activity in the circled areas on the child on the left. Child on the right is almost no activity. This is neglect. The child on the right grew up in a Romanian orphanage. And in those orphanages, children were often warehoused. They're kept alive, but there were no caregivers or few caregivers, and there was no peekaboo, there was no mommy holding you and looking in your face. And so this child didn't have that opportunity. The branching and pruning thing didn't work right, and so there's no neural activity there. This child can see clearly. This child can see clearly because there was visual input from the eyes to the visual cortex. But the associational part ain't there. So, let's talk about these kids as they're ready to come in. And this is in the womb, but we're going to talk about what people can remember about their childhoods and how it affects the flow of their lives from the time of conception, the time of birth, moving forward in their lives, and the effects of adverse childhood experiences, and our ability to predict the behaviors of this child, the diseases and social functioning, maybe the later capacity to hold a job or to read or write or perform in school or to end up in the juvenile justice system. If we know enough about what this child experiences, we can begin to predict those things. If we can predict them, we can prevent them. So now I'm going to move to the adverse childhood experiences study. Here at the bottom of this pyramid is adverse childhood experiences. We call them ACEs, the acronym ACE. And the pyramid uses a whole life model from conception to death. So life is moving forward in time this way. And I want you to look at the red part of the pyramid, which is where I was stuck. In fact, I was stuck in the higher levels of the pyramid in my training. That's where I was stuck. It doesn't work real good up there. I'm glad there's people out there to treat me if I have a heart attack or a stroke. But if we want to prevent those things, you have to work in the red part, which is where I spent the second half of my career, looking at risk factors for disease like smoking, high blood cholesterol, hypertension, the things that cause the common causes of death in the United States and disease and disability. And what we learned in the 80s is that these risk factors in the red part of the pyramid are not randomly distributed in the population. They don't. If you have them, your risk factors don't just fall out of the sky and enter your life. And if you have one, you tend to have multiple risk factors. They cluster. So what this told us is that if there's this non-random clustering of risk factors, there has to be something before that, a non-random generator down here that's putting these, what's getting these risk factors into people's lives. And we said that maybe it's the experiences, adverse childhood experiences. that affect brain development in a way that there are social, emotional, and cognitive impairments throughout the brain that lead to risk factors and disease and disability and poor social functioning. We chose 10 categories of experience to study. Those are abuse, emotional, physical, or sexual, neglect, emotional or physical, growing up, witnessing domestic violence, that is, seeing your mother being beaten as a child in your first 18 years, growing up with people that have used alcohol or drugs in your home, mentally ill caregivers or household members, parental discord as evidenced by separation or divorce, and is not to judge whether separation or divorce should or shouldn't happen, but it's stressful for children when the parents don't get along, and there's loss. And finally, crime as evidenced by having someone sent to prison, imprisoned when you were in your first 18 years of life. What these all have in common is they're stressors, and they're all contributors to the continuum that was talked about this morning, that continuum of okay stress to moderate to toxic and just to overwhelming stress. They all add up. They all add their own dose of poison in children's lives. So the ACE study was conducted in San Diego County, and we're still following these people, 17,000 people who are members of the Kaiser Health Plan in San Diego County. They were adults when we recruited them into the study, 19 to 94 years old, well-educated people mostly. Most of these people had gone to college, almost half had graduated, and only 6% do not have a high school diploma. It's a middle-class, upper-middle-class community. Upper-middle-class community. And they have great health care. Some of the best in the country. Is the deal over? They're educated. They've got enough money to be in the middle class, and they got health insurance. Right? So as you look at this, I want you to think about the demographics of this population when you see the adversity and the effects of adversity in this population, and know that in other populations it's worse. This is a best-case scenario for our country right now. We did the study, data collection, in 2 waves. It took us about 2 years to recruit all the people, to get the 17,421 people in the study. They filled out a very sensitive, detailed questionnaire about their childhood experiences and family. And we also have detailed information from the standardized Kaiser Health Plan records. So we have this huge database with hundreds and hundreds of pieces of information about people's past lives, about their current life, and we're following them forward. If you look at the arrow, forward in time, we'll continue to follow them to see their causes of death, the diseases they get, their health care utilization, and what drugs are prescribed for them. And we're going to go through some of those things this afternoon. The first thing that we found is that adverse childhood experiences are common. I did not know that. I transitioned from heart disease research to this stuff serendipitously, and I was the first one to look at the data when it came in to the Centers for Disease Control, and I wept. I'd spent 5 years traveling back and forth from Atlanta, San Diego, meeting patients, designing the study. I had no idea. 27% grew up with substance abuse, 1 in 4 with separation or divorce, 17% with mentally ill household members, 13% could remember seeing their mothers being beaten when they were growing up, 6% had someone sent to prison. Abuse was common, 11% for psychological, 28% for physical, and more than 1 in 5 had been sexually abused. It was 26% for women being abused as girls, and 16% for boys. And neglect was also common. So these things are really common, to me strikingly common, especially given, again, the demographics of the community. The next thing that we saw is that these experiences come in clusters in the lives of children. They don't tend to occur separately, just one category. They tend to be exposed to multiple categories. So let's look at alcohol abuse in the home. This shows the relationship of alcohol abuse to emotional abuse here. So in the green is no alcohol abuse in the home. One or two or more people abusing alcohol in the home. Emotional abuse goes from 5% to 35%. Stepwise, into the more dysfunction there is around alcohol in the home, the more emotional abuse on the left, the more physical abuse, and on the right is sexual abuse. It jumps up 2, 3, 4, 5-fold as there's more alcohol abuse. These are the other categories of ACEs. More, as they step up, that's more and more alcohol abuse in the home. Domestic violence increases dramatically, seeing your mother being beaten. Mental illness here. Street drug use, suicide attempt by a household member, or having someone sent to prison. So where there's alcohol abuse, there's all the other adversities. Yeah. About domestic violence. How does domestic violence interrelate with these other experiences? This is like the previous set. The left is emotional abuse, the center is physical, and on the right is sexual abuse. And the colored bars are the frequency with which people reported seeing their mothers being beaten growing up. White is never. This is once or twice, sometimes, often, or very often. And the scale here is remarkable because this is about 5%. That's 80%. So where there's violence against the women in the home and the primary usual caretakers in the home, those kids are really at high risk for abuse of all forms, neglect of all kinds, and all kinds of other adverse childhood experiences that are all toxic, poisonous stressors for their brain development. So if you were one of those imagine you're one of those 17,000 people and you participated in this study, and you were one of those people that told us that you had witnessed your mother being beaten when you were growing up, your chance of having one of those additional ACEs in your life is 95%. So where there's violence against mom, it's almost universal that there's other stressors in the environment around that child. If you go to 5 or more other ACEs, it's 52%. So half of the time, you would have 5 more. The mom is 1. 5 more gives you 6. And it adds up, just as exposure to eating lead paint adds up in your life. So we created a score. We took those 10 categories of experience and added them up. We counted 1 point for each type of experience growing up. 1 point for each. And I now think of this score as the trauma dose. The trauma dose is the aggregate or cumulative exposure to fight or flight. For a score of 0, only 1 in 3 people in the Kaiser Health Plan in San Diego have an ACE score of 0, had none of those childhood experiences. 16% had 4 or more. That means that if you're a service provider in that plan in San Diego County, that 1 or 2 out of every people that you provide any kind of human service to in that system carry with them the biology, the developmental biology of 4 or more adverse childhood experiences. And the providers don't know that because they're not trained to ask about it. It's really easy to do. People will tell you, so it can be done. And the clients don't know it either. It's easy to teach people to do this. When I do community presentations, there's a line at the podium. And people are not afraid of this. It does not traumatize. They come up, my ACE score is 8. Why didn't somebody tell me about this before? I've been abusing alcohol or drugs, or I have all these health problems, and gosh, it makes sense to me. So this is why I believe in the population-based approach to using this kind of information. It's not just for experts or people in the field. It's for everyone. People understand this information. They really do. It doesn't freak them out. They want it. So let's go through a set of slides now that looks at this trauma dose, the ACE score, as it affects people's lives. So here on this slide, we have the ACE score going from 0 to 6 or more. And the height of these bars is the percentage of people here, 5% to 30%, who moved, changed their residences 8 or more times during childhood. And we talk about relationships and losing attachment and community. In these kinds of environments, the families are almost nomadic. And you provide the services, they're almost nomadic. They're very unstable in space and in community. And it's hard to provide services for people that are moving around. And this is the pathway to homelessness. The end of this is not having a home at all. Did it again. What about smoking? Here is the ACE score going up. This set is increasing percentage of people that become regular cigarette smokers by age 12. Not experimenting, but being a regular smoker by age 12. The middle set is being a current smoker as an adult, average age 50. That triples across the score. And here is the percentage of people that have lung disease caused by smoking. Chronic lung disease, bronchitis or emphysema. So in the presence of adverse childhood experiences, more and more experiences lead to earlier regular smoking, the maintenance of the smoking behavior, and the consequence is the disease. And so this is the life course pathway that we see over and over again for, if you want to prevent lung disease, how many physicians or pulmonary doctors would say, well, tell me about your adverse childhood experiences? I mean, you're laughing, but nobody asks this. And that can change rapidly, too. That's something that can change. Alcohol use. Let's just look at the last two sets on the right. This set is the percentage of people who are alcoholics, trauma dose, and alcohol, or relationships. This is the percentage of people who ever married an alcoholic, men or women. So it affects who you become intimate with and bond with. We see the same thing for marrying people that use street drugs or addicted to street drugs. It affects who you relate with. Here's injected drug use, shooting up, taking a needle and syringe and shooting up. Promiscuity, having 50 or more intercourse partners, and this is ever having a sexually transmitted disease. These are all risk factors for AIDS. What causes AIDS? Is it a virus? Or is it the behaviors that transmit them? The virus would go away if it wasn't transmitted. So what causes AIDS? Adverse childhood experience causes AIDS. What causes lung disease? Adverse childhood experience. So what we've done is we've created a society that treats the symptoms rather than the cause. The disease can be the symptom or the behavior can be the symptom. The cause is what shapes human behavior. Let's talk a minute about that little green bar there. This is a large study. There's the experience of 5,000 people is represented in that little green bar on drug abuse, on shooting up drugs. If you look at the computer printout from those 5,000 people, the percentage of people that have ever shot up is almost 0%. If you don't have childhood adversity, it's hard to find people who will shoot up drugs. So this is almost zero. The risk is increased 40 times for an ACE score of 4 or more. Now let's go back to those, think about those 12-year-old regular smokers. If you went to a mall or a school or a playground and you had 100 kids, regular smokers on one side, and 100 on another side who are not, may have tried, but said, gee, that tastes bad, or it made me cough. They don't keep using. Why? The kids who keep using because what are the effects of traumatic stress that we've already heard about this morning on how people feel? Anxiety, depression, confusion, difficulty thinking clearly. What does nicotine do? It reduces anxiety. It alleviates depression and confusion, and it helps you to think more clearly. The highest percentage of smokers that I've seen consistently in any group is people that have schizophrenia. Does anybody here deal with people with schizophrenia? Do they smoke? Most of them? That's not an accident. It probably helps their functioning, and they may not think of it that way, but it probably does something that's beneficial to them in a way that's unconscious. Just as it is for those kids. They don't say, oh, I'm going to keep smoking because it alleviates my anxiety. There's positive feedback loop. And the same thing for heroin. Do heroin addicts go to career day at school and say, wow, that sounds great? Is that a cortical function? Of course it isn't. Most people that shoot up do not become addicted. Did you know that? Did you know that in Vietnam, there was incredible heroin use in Vietnam? Most of the veterans of Vietnam came back and stopped. So why is that? We're trained to think of these substances as addictive. If the substance is so addictive, why can some people use and stop and other people can't? It's about what the person brings together with the substance. And this is sort of the basis that I learned about a few years ago of trauma-informed care for people with addictive disorders. It's a functional behavior because it makes things better. That's why we do it. We're very adaptive organisms. So if shooting heroin alleviates your psychic pain and helps you to get away from whatever it is that's so painful or confusing in your life, it's really effective for that. It's very effective behavior. It has a ton of negative consequences, as does smoking. If cigarettes didn't cause disease, I would prescribe cigarettes. I would. Cheap and effective. So these are understandable behaviors in the face of neurodevelopmental trauma of adversity. Teen sexual behaviors. Here we have first intercourse by age 14. Earlier sexual debut for teenagers goes along with adversity. Teen pregnancy, women ever having at least one teen pregnancy goes up, as does for the guys ever getting teen girls pregnant. Adversity plays a causal role in the occurrence of teen pregnancy for both males and females. For adult women, and part of this, I believe, is it plays some role in the intergenerational cycle in as much as adversity affects reproduction. More teen pregnancies, and for adult women, these are pregnancies that occurred after age 25. And this is the percent of women that reported that they got pregnant, but they weren't trying. Doesn't mean the child was unwanted. So there's more and more unintended pregnancies in women with a lot of adversity. And there's also the graph for elective abortion looks like that too. And it's not a political statement. I don't care what you think about that. I don't know anybody that's pro-abortion. More traumatic stress, more abortions. Depression. The leading cause of disability in the United States is what? It's getting easier. These little quizzes. That. That's the leading cause of disability in the United States and developed countries. This goes from 15% to 60% for women and a similar pattern for men. We estimate that half of depression in the Kaiser Health Plan, and probably other places too, by extension, maybe worse in other places, half of depression has its root origins in childhood adversity, the leading cause of disability. Suicide. Suicide goes from 1% attempted suicide to 20%. And sadly, in the thinking about this as an adaptive behavior, it's sort of a sad adaptation. The way out. It's not random. Suicide is, and you know probably, suicide is a highly non-random behavior. It's created, generally speaking. Heart disease. At high levels of the ACE score, this is coronary disease, heart attacks. This is for women. What's the leading cause of death for women in the United States? Heart disease. Okay. Causes heart disease. It causes lung disease. It causes liver disease. Liver disease goes up. These are the leading causes of death. Some of the leading causes of death in the United States. If you didn't have liver disease and you wanted to get liver disease, you decided today that you wanted to get it, what would you do? You'd drink? What else would you do? Shoot up with contaminated needles? Have a lot of intercourse partners? And find somebody that's infected with hepatitis virus and have it sexually transmitted to you, or take other toxic substances? So, in this life course model, the adaptive behaviors have the unintended consequence of exposing to people that destroys the organ called the liver. One of the things we were asked is this just some crazy Southern California population of kooky people, and does this apply anywhere else to anybody? So one of the things we did is we looked to see whether the effect of childhood adversity on people's lives was dependent upon when they were born. So what we did is each of these lines is a different set of birth years. Blue is 1900 to 31, red is 32 to 46, and then 47 to 61 or 62 to 78. Vastly different sort of societal norms and secular trends throughout those many years of the last century. And those lines are splayed a little bit. Statistically, those lines are identical. So no matter whether you were born in the early part of the last century or the later part of the last century, the biological effects of adversity are sustained. That speaks to the overwhelming impact of neurodevelopment and the adaptive behaviors people will find. This is alcoholism here on these lines. If it's in the environment, you will find it, and you will get that reinforcement and use it as a way to cope, as a way to deal with the traumatic stress. What about intimacy, or things that look like intimacy? It's a wonderful thing. That gets really messed up. As you know, you're dealing with domestic violence or other, that gets really messed up. In adulthood, not as childhood, as an adult, women have a probability of being victimized, beaten by their intimate partner of about 3 or 4% with no ACEs, and it's almost 15% with 5. And so these graphs, I know they're all starting to look the same, and I'm not going to show too many more, but I could show hundreds of graphs like this. It's mind-boggling. And the fundamental thing is what we stumbled into was the cumulative toxic stress model of where behaviors and health problems originate because of our operating system and the software and all the loading that Sandy talked about gets screwed up everywhere. The whole thing can get screwed up. So people fall in love with somebody and are intimate with somebody that beats them and they go back. Or you fall in love with somebody and you beat them. You talked this morning, you said, somebody said this, or a woman that mistreats you. It doesn't mean they don't love your child. And it doesn't mean they don't love each other. But it's screwed up. Can't control it. Rape, sexual assault, as an adult. 1 in 3 women with an ACE score of 5 or more have been sexually assaulted as an adult, at least once. And it's only about 2% for those with an ACE score of 0. So people are, the risk of becoming a victim is generated by the consequences of stress on brain development and recognize dangerous situations, or if you abuse alcohol or drugs, or you're promiscuous, which is not your fault if you are. It's a consequence. Then you are at risk of finding somebody who is sexually assaultive, or not being able to defend yourself, or get away, or see that it's happening. What about the costs? Let's look at a couple of vignettes here. Let's talk about healthcare, the costs of adversity, prescription drugs account for 44% of the annual rate of inflation in healthcare. And we're talking about fiscal crisis and Medicare and healthcare reform. And I'm glad we're talking about that. But what's generating a lot of the unnecessary costs? We saw depression a few minutes ago. This is depression and ACEs. Here is, in the follow-up phase of this study, we have every prescription for all these people. There were I didn't know how much to expect. There were 1.5 million prescriptions written for 17,000 people over the first 7 years of follow-up. That's why we're spending so much on prescription drugs. I'm not saying they shouldn't be prescribed. Some of them don't work very well, like these things for some people, antidepressants. Half of the prescriptions that were given out over those 7 years for antidepressant medications have their origins in childhood adversity. Half of the cost for treating depression in adversity. I'm going to move on. Treating anxiety. These are drugs for treatment of anxiety as the ACE score goes up. Lithium. Lithium-based medications. This is sort of choppy here because it's not commonly prescribed. But people with an ACE score of 5 or more are 16 times more likely to have somebody take out their prescription pad and say, take lithium. Bipolar disorder. Is bipolar disorder genetic? I'll get on my soapbox here about that. Is it genetic? Is it nature, nurture? Or both? Probably both. This suggests that it's a lot about nurture. Antipsychotic medications, same pattern. So throughout the whole range of mental health issues that can be generated, adversity generates them all, and it ends up as adults, people taking a prescription card and say, take that medication, and most of the people prescribing it have no idea what they're treating. They're treating the symptoms, they're not treating the disease. What about corporate America? Depression here is labeled, back pain and chemical dependency are the 3 underlighted areas. Social isolation and poor understanding of social cues, which leads to conflict, leading to development of alcohol, tobacco, and drug use, special education, school failure, dropping out, suspension, expulsion, delinquency, dropping out. And we see all of those in the juvenile justice population. You get low-wage jobs, unemployment, public assistance, prison, poor health, and poor mental health. It's fast track. And how do you get out? How do you get out? You need to have something enrich your environment so that you can get out of that. How is it? And so one of the questions is, how do you enrich the environments of children in poverty? How do you do that through the parents, or through special programs, or through population-based programs for everyone? I'm going to, okay, here's that adult brain we saw earlier, and I'm just going to mention a couple things. This pink area here is called the corpus callosum. It's the information superhighway of the brain, the white matter of the brain that connects the left brain with the right brain, and also up and down. It connects all the different functions of the brain so they can talk to each other. In people who are abused as children, adults abused as children compared to those not abused, that there are 17% fewer nerve cells, up to 17% fewer nerve cells in the information superhighway that makes the brain work right. This memory part of the brain, called the hippocampus, tends to be smaller. And the more, I could go on for a while, but the more and more sophisticated the neuroscience studies become, the more differences that are identified between people stressed as children and people not stressed as children. All sorts of brain structures and functions. ACEs affect an array of brain functions. What we did is we said, we've looked at things one at a time, like drug abuse and alcohol or relationship problems. we said if it affects all of those different parts of the brain as they're coming online from 0 to 18 or 0 to 30 or whenever it really is maximized, it can affect the way you feel, affect regulation, your bodily issues, pain, obesity, sleep, substance abuse. These are the white-colored things, sexuality, memory, and arousal. And there's 18 different things that we pulled out of our database under those headings of generally different brain functions. And so what we did is we created a score. How many of those 18 things did people have operational, those problems operational in their lives from 0 to 18? And we took the average. And what we found is that for people with an ACE score of 0, they averaged 1.5 of those 18 problems. But the number of co-occurring problems jumps up from 2 to 3 to 4, and when you get to 7 to 8, the people average 5 of those problems in their lives. How do you deal with that? And do you know that? So if you're looking through the lens of substance abuse, did you know that person can't sleep, that person has all these other problems, and is that which is the one, or which are the ones that are going to be the most fruitful pathway for helping that person overcome the effects of their trauma? So this is from a Greek myth, and we don't have time to. I like to tell the myth story, but this is from a Greek myth, and I see this. You look at this girl, and I see this as this happens to be in the myth. This happens to be Satan reaching up and grabbing a girl, pulling her into hell. Well, how dark is the grip of developmental stress in the lives of women collectively? Doesn't mean she can't break away. I'm trying to be hopeful here. This is hopeful because now that we know this, we can prevent it. Yeah? This is hopeful, but just as a way of measuring how strong that grip is, these numbers, these percentages here for current depression, we estimate that 54% of current depression in adult women is due to childhood adversity. 60%, almost 60% of suicide attempts could potentially be prevented if there was no adversity. 2/3 of alcoholism, half of drug abuse, almost 80% of shooting up. These numbers, you almost never see these numbers in health studies this high. And we see them really high over and over. For half of promiscuity, almost 2/3 of sexual assaults, and half of domestic violence. And that's just using the crude tools that we used and measuring the kinds of stressors that we measured. If you measured more, my guess is these numbers would go even higher. So adverse childhood experiences, I believe, are bar none, by far, the most important national health and social issue. If we can address these, we can address our health and social issues. It affects adolescent and reproductive health, smoking, alcohol and drug abuse, sexuality, mental health, victimization, stability of relationships, and the performance of our national workforce. It increases the risk of dying early. People are twice as likely to die by age 65 with high ACEs compared to low ACEs. People die younger. They get heart and lung disease. They get lung cancer, liver disease. They commit suicide. They die of injuries. And they get AIDS and other things that I don't have time to talk about. This is the hit list. If you had a consensus conference, this would be on the hit list. Can you hear me now? It's cutting out. Okay. This would be on the hit list of national priorities. And this is, I'm trying to get towards our discussion now. What is one of the biggest problems that we have is current practices of everything in health and human services is fragmented by categorical funding, turf battles over funding, categorical thinking. That's my health problem, that's yours. That's my social problem, that's yours. And we go at them separately when in fact they're all intertwined. Organizational boundaries, and a symptom-based system of care. We treat the symptoms, we don't treat the cause because we haven't been taught to think about it. And so I think if we have we have trauma-informed care some places now, We need a trauma-informed culture. That's the public health approach. We need a trauma-informed culture for everybody, regardless of where you live or how much money you have or the color of your skin or your education. Everybody should get this because it's everywhere in our society. So I'm going to end with a piece of art. I'm going to end with a piece of art. This is from the labors of Hercules. Hercules was asked by Zeus to perform 12 amazing feats, daunting feats, one of which was to slay a mythical beast called the Hydra. This thing is a multi-headed dragon that spewed out sulfurous fumes out of its heads. And depending upon where you read this myth, it had 10 heads or 1,000 or thousands. I think it has an infinite number of heads. I'll tell you what, it has thousands of heads. So Hercules went out to slay it, and being the great warrior that was, he took his sword or his club and whop! Got one. That one. He got that one down the bottom there. Got a head. What happened, when he cut one off, 2 grew back. Okay? You may see where I'm going with this. When you cut one off, 2 grow back. And so the goddess of the hunt, Athena, the goddess of the hunt, sat one of her mortal buddies, I don't remember his name now, and he had a torch, firebrand, and he went out to see how Hercules was doing, and he discovered that if Hercules cut off a head and he cauterized it with a torch, we've made progress. Nothing grew back. We got 1 head is down. And so what this is the first mythological documentation of interagency collaboration. Okay? Now, I see traumatic stress in every piece of art, but in this piece of art, this is the body, the embodiment in the biology of stress in a person. And the more embodied stress there is, the more heads there are, the more learning disabilities, the more criminal justice problems, the more alcohol, the more promiscuity, the more HIV, the more suicide attempts, you name it. The more sexual assaults. On that, and all those things on that list. So these people, they don't just have 1 head. They got multiple heads. How do we deal with that? And if you took a mirror, if I held up a mirror here to that creature, and I hold it out to you and you look at it, what do you see in the mirror? See yourself. I see lots of heads in here. What organization do you represent? Do you deal with depression? Do you deal with early childhood development? So I'm not criticizing you. The natural and probably good for the time being response of our culture is to look at the heads one at a time and develop a system around each one. The challenge is going to be, how do you take your expertise and what you deal with and understand that you are rowing in the same direction with your partner dealing in another part of the system, using the same language, using trauma-informed care, whatever you want to call it, understanding the same concepts, and doing your part. And in doing your part, you're going to make things better for the person sitting next to you, because they all have the same cause. Are you with me on that? I think it's really important. We're going to discuss, I think, hopefully, silos. I used to talk about breaking down silos. I don't think that's possible. I don't think it's going to happen. And now I have this fantasy of having a helicopter flying above all the silos and dropping the same information and program and concepts and language into these silos. So you go to the next one and say, oh, here's what we're doing the same thing too. Why don't we do this together and then go to the community and be unified in the way we talk about things and deal with things, and teach other providers and teach your clients and teach the population of Western New York, the 1 million people. My dream is to teach the entire United States with a national program. And that's where I'd like to go. I thank you for inviting me here, and thank you for the work that you do.